Hi guys, welcome to Why Leadership Fails. I am your host Bhavna Lalchandani. In today's episode, we have a unique and a distinguished guest, a trailblazer in the field of neurology. He has made significant contributions in the field of stroke. He has over 3 decades of experience treating various neurological disorders. Well, he has also won various awards such as the most inspiring neurologist as well as the topmost neurologist in the field of stroke. Well, I am super excited to get to know the person behind the doctor's mask and also the leader that he is. And at the same time, let's explore the mysteries behind the human brain. So stay with us as we dive into this mind-boggling episode. Let's welcome Dr. Shirish Hastak, Director, Neurology, Stroke, Neurocritical Care at Gleneagles Hospital, Mumbai. Hello, Doctor. Welcome to Why Leadership Fails.
Thank you, Bhavna.
Pleasure to have you here. I'm super honored.
Thanks for that introduction, and thanks for having me.
Great. So I'm really curious to know that were you always fascinated by the human brain, that you delved into neurology as a profession? And more so, you were, practicing in Canada throughout. What made you really come back to India? That too in the early days when people were all traveling there.
Yes, I think, the brain is the most fascinating organ in your body. So if you ask me, without our brains, we are nothing. And I think, Sherlock Holmes affected me in that sense that, what he said was, I'm but a brain, Watson. The rest of me is a mere appendix. Of course, my cardiologist and nephrologist friends will forgive me for that. But the brain always fascinated me. And it's the most mysterious part of your body. And it's the part where you know the least, at least in terms of its complexity. It's the most complex organ in your body. It's what makes you human.
Absolutely.
There's nothing else in your body that makes you human as much as the brain. And that's why I think it fascinated me all along. And then, when I started doing my MD and I had to decide what to do, surprisingly, neurology used to be the case to be presented during your exams. So then, of course, I studied neurology and I liked it because it was one of the things where you could make precise diagnosis.
Yeah.
Very precise. It was like mathematics. Where is the problem and what is the problem? And in the neural axis, and we call it the neuri axis, you could actually tell from the brain to the nerve to the spinal cord all over. Okay. You could make a perfect diagnosis. It was like pinpoint diagnosis. And I also felt that it's one of the sciences where, the father of medicine, William Osler, he's the father of medicine, he would say that, listen to the patient. He's telling you the diagnosis. And in neurology, this was very, very true. So I was fascinated by this idea of becoming a neurologist. So I think I moved ahead and, moved into neurology. I'm still fascinated by it. It still is evolving. There's no brain transplant as yet. I was trying to check it, whether it happens, because some of my friends have been telling me, you transplant everything else. So why don't you transplant the brain as well?
Oh my God.
So that's not yet happened. But it's pretty close. It's not too far away. And you're looking at, you're looking at whole head transplant. And probably in the next 10, 15 years, you look at a brain transplant. So the body of another guy and you put in the brain of this guy.
And all those signals, the memories, everything gets literally to have to even test that. Whether
yes, I think it's a fascinating area. The most complex system, because connecting the brain is like, it's like connecting the whole universe together, because the number of thought patterns in your brain is more than the number of atoms in the universe.
True.
So it's the most complex system.
Sure.
So I guess it may take some time, but it's probably going to evolve into that. It fascinated me.
Absolutely. And when we talk about neurology, brain, etc., of course, the Western world is much more advanced. You were practicing out there, and then from there, how come you traveled back and you settled in India after practicing for so many years out there.
Yes, actually, I went for my fellowship to Canada, and I'm talking about 1989. So 35 years ago, I went for my fellowship to Canada. And then, of course, India was a totally different country. You had 2 channels on the TV, and, you didn't have anything that exists today. So it was a totally different. It was like a culture shock to me to go to Canada and see the other side, which was highly developed and so on. So I went from this government municipal hospital to a university hospital in Canada, where, of course, the number of patients were much less. So you spent much more time with patients, unlike what you do in the government hospital in India. And so it was a completely different environment. You spent more time, you were more friendly with patients. In fact, my chairman of the department in Canada, once, one of the old ladies could not remove her shoes. So he sat down on the ground and he removed her shoes.
Sweet.
So it was something that, really took me, I said, this is, really something. You're so close to patients and you feel so comfortable with them. Of course, it's a cultural thing as well. It's not the same. But I also felt that, you need to go closer to patients. You need to understand them better and not be in this, in the white coat of yours and, try to be closer to them, try to understand them better. So it did help me open up my thinking. And coming back to India was an interesting thing. It never, at that point, I thought I will stay back in Canada. And, my boss, of course, said, why don't you settle here? You can do your, stroke here. But then, it just happened that one morning I went to the OPD and I had this 70-year-old lady, quite prim and very, very sophisticated, nice lady.
In
but
India?
In Canada.
Okay.
In Canada. So I was thinking whether to come back or not come back. Those thoughts were going on in my mind. And between me and my wife also, we were discussing this. And so this lady asked me, are you an Indian? I said, of course. I mean, I look an Indian. You can make me out an Indian. So she said, can I ask you a question? And I said, yeah, sure. She said, why do so many Indian doctors want to settle in Canada? And then, I was taken aback. And then she said, what, if you guys are so smart, why don't you go back and help your own country? And also she made a point, which is, I think, very relevant. If Canada becomes poor, would you guys stay here still? So that hit me somewhere. So I felt that, maybe I should go back, look at it and, so that's what really pushed me back. Started thinking that maybe I'm better off coming back.
Thanks to the Canadian woman. So, that we have
Yes.
a trailblazer in neurology like you. That's an amazing story. So, you practiced in so many different places and you did speak about the doctor-patient connect, right? So how have you actually shaped that with respect to the overall patient care approach? And currently what are you really involved in? What are you really doing for that in terms of community building and basically helping patients in terms of beyond treatment?
Right. So what happened was that when I came back, I realized that I need to have a better connect with my patients. So I set up a clinic on Pedder Road. Those days, Pedder Road was the place to, practice. So yeah. So I set up a clinic on Pedder Road. And, there I had a living room style clinic. So because I realized that, patients are given small stools and doctors have these big chairs, So that difference. Plus there's a huge, sort of a huge table between the patient and the doctor, like blocking. So I removed all that. I kept the same size chair for the doctor, that is myself, and same size chair for the patient. And removed everything, just kept a small table, like you have in your living room, which is much more friendly.
Yeah.
And that was how I started my basic thinking. And then I from that, of course, after about 5 or 7 years, when I moved into Lalchandani Hospital initially, I set up a stroke support group.
Nice.
Because I also felt that, I need to get closer to patients. So I ran that group for about 15 years.
Wow.
only to then realize, and as you grow, then your thinking also grows and your ideas also grow. So then I thought that why should I restrict myself to stroke? Why should I not help overall development of medicine? And then it just happened, I went into some creativity seminar and I met a lady called Mrs. Rajashri Menon. So Rajashri told me, Doc, we have an organization called Walk with a Doc.
Okay.
And then Walk with a Doc is an organization where you educate, exercise and empower.
Interesting.
So you not only, because stroke support was only educate.
Yeah.
There wasn't exercise at all. And so I said, yes, exercise was the next thing coming in.
Which is the most important part for a stroke patient.
And I also felt that I need to get other doctors also involved into supporting the community. So then I formed the Walk with the Doc group. And the Walk with the Doc group is basically a group which meets every month. So the first Sunday of the month at the Mahalakshmi Racecourse. The last 6 years we've been doing it. We had about 65 meetings to date, and different specialists come in. So it's not just Dr. Hastak. It's, different specialists come in. So I've had the cardiologist, nephrologist, gastroenterologist. And in fact, this time we're going to have the hand transplant guy.
Hand transplant?
Yes, full hand transplant. And both hands transplanted.
Wow.
So we're going to have him speak on Walk with a Doc. So this way we educate, exercise and empower people. And so I think, this creates more awareness in the community about disorders, which, needs to be done.
So, Doc, as they say, right, in the field of medicine, precision is the key, accuracy is the key. And when it comes to failure, there is a very minimal scope. Nazar hati, durghatna ghati. So, how do you really manage any setback or failure? Has there been a significant one in your medical career that has actually left a lasting impression on you? And what are the valuable lessons that you learned from it?
Yes, I think I remember a patient about 30 years ago who was admitted with my friend, an ENT colleague of mine, and he was referred to me for headache. And he had a little ear discharge on one side. So we saw him the first time, we examined him quickly and looked at his charts and other things, and it showed that his counts were normal. There were no inflammatory markers, nothing. And so we said, this is because of the ear discharge, he's getting a headache, so he should be all right. Just give him a little antibiotic and he should be fine. But 3 days later again he was referred back to me. Again we saw him, we again looked at him, quickly reviewed him, and again felt that it was only because of the ear discharge and nothing else. But he continued to have the headache. And again 3 days later my friend calls me and says, hey Dr. Hastak, this guy is not recovering. Why don't you transfer him over to your side? And as soon as I transferred him over to my side, I realized my approach to the patient changed. I examined him in more detail. I looked for other signs which I had not looked for when he was under the other doctor. And then I looked for a sign which is called Kernick's sign. Kernick's sign is a special sign for meningitis. And that the Kernick sign was positive. He didn't have the other common signs of meningitis, which is called neck stiffness. He didn't have that. But he had the Kernick sign. And so when I examined him, it was suddenly different, because he was transferred under me. And now I was fully responsible for him. So the Kernick sign was positive. So I realized that this could be a meningitis. We quickly did his lumbar puncture. He turned out to have a tuberculous meningitis.
Oh my God.
And he responded luckily well. We had missed him for about 6-7 days, but he responded well to steroids and to anti-TB treatment, and he did well. But the lesson I learned from it is that no matter the patient gets admitted under you or someone else, you need to see him in detail properly. From that time, I try to spend the time that I would spend with my own patients, with other people's patients as well. Because I think ultimately the patient comes to you as a patient, and you need to give him the best. And that changed my thinking about others' patients and my patients. And that was a big lesson to me.
Absolutely. Interesting. So, whichever patient it may be or whoever's, I think that detailing becomes very important. Right? That's what you're trying to say.
Very important.
Great. So, talking about patients, is there a memorable moment, that you've had with a patient, some patient story that kind of, till date has left that mark on you?
I remember, stroke in the past was an area which, some of my friends would say would be like a veranda care area. That means you would leave the fellow at the veranda and the next day morning see if he's around or not. But
Oh my
that
God.
has changed dramatically over my practice. So 35 years ago, there was no treatment available. Until I think about 1995, the thrombolysis came. That means the clot bursting came. Before that, there was no treatment for stroke. So 1995 that came. And I think somewhere around 2000, I remember this patient. So one Sunday morning, I was just relaxing with my family, and I get a call that there's a patient admitted who has, lost his speech is impaired, and his left hand and leg is weak, completely gone. And he's only about 45 years old. So I rushed to the hospital, and I know that this drug has just come into India. And I immediately call for it and talk to the wife and explain to her that there's a small risk of bleed from this drug, but I think giving it is the right thing to do. And this is science now. She agreed. And so I gave this drug, which is called tissue plasminogen activator. It's like a clot bursting drug.
Sure.
So this was the first experience of the clot bursting drug that I did. I gave it to him, a young fellow, and I've sat next to him hoping that he would recover. And 1 hour later he had not recovered. 2 hours later he had not recovered. So I was a little bit disappointed. I said, it's probably over. This is not going to work. So I went around with my rounds. And in those days, I think, just the mobiles had just come in with, that the system of sending SMS had just come in. So
The pager.
The pager had come in, and just after the pager. This was immediately after the pagers.
Okay.
So there was there's huge mobiles, with just the SMS and stuff like that. So this
Nokia
guy's,
ones.
the small ones, the initial big ones with, you got to pull out a aerial out of it types. So this guy sent me an SMS saying, I'm using my left hand to send you an SMS. Doc, I have recovered.
Oh, nice.
So that was, a terrific moment, because this was the first thrombolysis probably in Western India and maybe in India as well, because it was very early days of thrombolysis. So I suddenly realized that this field is going to change. From that time, everything has changed. In stroke, there's a lot of hope now. And this window, which we used to have of opportunity in stroke, started off with 3 hours. So if you came in with a stroke, which is a certain type of stroke, which is called ischemic, within 3 hours, you could give this thrombolytic agent. Now it has moved to 4.5 hours. Then it moved to what is called as mechanical clot retrieval to 6 hours. Now mechanical clot retrieval moved to 9 hours. It moved to 16 hours, and now it's 24 hours. So there's a lot of things happened over this 35 years of practice.
How do you foster team synergies and ensure that you kind of inspire and motivate them during such critical surgeries or generally even day to day?
Yes, so basically, I think at that point, I think about 25 years ago, we set up the first stroke unit in Western India. And then we also set up a stroke helpline at that point. And then, we built the stroke unit around, of course, the neurologist was important, but we also had the neurosurgeon, the neurointerventionist, and also the neuro nurse, build a whole team around it. We also had, and I believe this, like a keystone habit. A keystone habit is a habit around which everything else builds up,
Sure.
So we had a keystone habit which we built up about 25 years ago, which is called the NIH stroke scale habit. So, strokes have a scale. And so, is this a mild stroke? Is this a moderate stroke? Is this a severe stroke? You need to know that to decide which way to go. So we built this keystone habit in the stroke unit and then built it at the emergency department, and then gradually built it in the cath lab as well, where you take your patients for mechanical clot retrievals. And from there, the hospital was sort of infused this habit, which is called the NIH stroke scale.
Okay.
And from that point, I started insisting that the whole team should put this NIH stroke scale on the discharge cards of patients. So even today, you'll see that a lot of hospitals don't put it on the discharge card, but I think I keep on encouraging people to put it on. To build teams, of course, there are two things. As they say, that you find your voice, but you have to help others find their voice. And helping others find their voice is much more critical.
Yes.
Easy to find your own voice.
Sure.
Very difficult to help the other guy to find his voice. I think one of the things that I have learned over the years is that each person comes from a different background, has different experiences. And because we experience things differently, we actually react also differently.
Yeah.
And to understand that the team is built around different people. So you have extroverts, you have introverts. You have people who are, say, relationship oriented versus you'll have people who are task oriented, who will do no matter what. So you have to balance these people out. Sure. And you have to, someone who doesn't think like you is not necessarily a stupid person. Or not necessarily. And initially when I started practice, someone who didn't think like me, I would feel he's not the right guy for the team. But gradually I realized he's actually teaching me something.
Complimenting.
Yes, complimenting.
Yeah.
So I realized that, in a team, you have to expose each other's strength and cover each other's weakness.
Absolutely.
Because weaknesses also exist. And this is true for me as well.
Sure.
So, I'm much more an extrovert and much more relationship oriented guy. I'm not but there are introverts who are much more analytical or much more task oriented. So they will do things, they'll have everything put on some sort of a data, and every time tell you how many patients, what happened, where, so on. That would irritate me initially, but then I realized, no, this is an important part of my team. I have to balance out at any rate.
So true. Absolutely. That becomes very important, and especially in today's day and age, right? It's all about collaborative efforts at the end of the day.
Exactly.
So, Doc, we spoke about, various different aspects in the past and in the present. While talking about the future, specifically when it comes to emerging technology, there's a lot of debate today going on, with respect to AI versus humans. So when it comes to medicine in terms of the field, do you think AI will replace doctors at some point in time?
A good question, because that's been going on, pretty heavily in the medical field, and especially for some areas, But what I would say is that the brain, if you look at the brain, I mean, the thing that it does is it predicts. It's a prediction machine, actually. And I look at AI also as a prediction system. And that's the core of AI, is predicting. Because all man wants to know is future.
Yeah.
If you have one quest in life, that is about knowing what's going to happen tomorrow.
True.
And so I think AI also does that. Its core is prediction. So at that core, AI works very well if the data is clean. But if the data is unclean and messy, which is what life is. In life, the data is never clean. And in medicine, it's even less clean. So if the data is clean and the systems are in place, yes, AI can help you make a prediction. But also remember that the AI tells you a probability. And it's not deterministic. It's only probabilistic. So ultimately from that probability, you will have to use a judgment.
Sure.
And you'll have to take an action.
Right.
So even though the probability is well done by AI, so long as it is a known.
Yeah.
If it's an unknown, AI is no good.
Absolutely.
So I think when it's a known, yes, AI is good and the data is good, so you get good probability. But in other cases, you won't get a good probability. You certainly will have to use the human brain and compute the probability. From that, I think if you look at AI, there are fields in medicine where AI is, emerging, like radiology or pathology and other diagnostics.
Yeah.
Yes, it is emerging. But I think ultimately, human mind is a judgment machine, which you still need.
Yes, agree.
Which I don't think will be taken over completely. At least I don't see it in the immediate future. I don't see it in the immediate future.
Honestly, if I were to not pass a judgment but just give my thought, I just feel that when it comes to disease, illness, I'm a pharma grad, by the way, myself.
Sure.
So I believe that humans, right, though the mechanism, the system is kind of, common, but every human is unique, right? So even in terms of complexities of the brain, it's so unique. Like for AI or technology, yes, when it comes to clustering, definitely, the predictive analysis would work. But when it comes to a unique, like you mentioned about meningitis, right? The person who came with a regular ear discharge and a headache, you clustered it like a normal, somebody who would have this regular headache and can be cured by XYZ. But it was a unique case. So as such, when it comes to a unique case, definitely the kind of experience that a human mind would get in, in terms of the doctors, I think that certainly cannot be replaced in any way.
That's so true. As I said, the data, is messy.
True.
It's not simple and clean, as much as we think it to be.
Yeah.
But it's messy, and in medicine, it's even more messy, because the same, and this is absolutely true in medicine, because you just think of a symptom like giddiness. So even if a patient falls unconscious, he sometimes says, "I'm giddy."
Yeah.
And so giddiness is one term that you have to really sub-classify and not use the data simply as giddy.
Sure.
So I think this brings the complexity, and humans are the most complex system. Since they are the most complex system, I think
Yes.
Humans will still need humans.
Absolutely.
You won't have AI replacing humans.
Correct. Humans will always need humans.
Yes.
And Doctor, one thing I really liked, about this conversation and what you said was that how can we get the voices of others, heard? That's the most important thing. And we believe in that as well. So, it is something that we reach out to our audiences to get their voice in this conversation. And with this, we move to our next segment, which is called Janta Unfiltered, where we ask the audiences to send in queries for our guest. So we have a question for you, and I would love to read that with your permission.
Sure, go ahead.
Great. So we have a question from Akshay, based out of Mumbai. And the question is, I've noticed that it's becoming increasingly harder to trust doctors and hospitals these days. We keep hearing stories that shake our confidence in the system. Lot of malpractices happening and patient care being compromised due to profits and target pressure. What are your thoughts on why this is happening, and how can doctors and hospitals work to rebuild that trust and ensure patients feel more confident in their care despite these challenges?
Right. I think, yes, this is true. This is true because, there's a lot of corporatization of medicine, and medicine has moved, into a different field. From that simple doctor who, the general practitioner, as we say, who would be available, all the time, and was a family man, would come to your home and sit with you. We have moved into specialists and super specialists, and, this was the need because the science is evolving at that rate. You can't have one man know everything.
That Vaidya that used to be there earlier in those early
who
days.
would come home and give you the medicine.
Yeah.
But I think medicine, the complexity and the understanding of the complexity needs that you have different people. So one of the problems that you face as a patient is that ultimately you end up going to 5 doctors or sometimes to 10 doctors,
Sure.
Today I had a patient who had already seen 5 neurologists before me, So he had already received 5 different prescriptions of different medicines for his epilepsy. Now, so I had to explain to him that the issue is this, that of course, no 2 doctors think alike perfectly, because no 2 humans think alike.
Absolutely.
So you can't expect 2 doctors to think alike. But I have to also explain to him that let me simplify your medicine, let me reduce your medicines to as far as possible, so that your life becomes easier. Because you must always remember that medicines have side effects.
Yeah.
And also that each doctor, and this is how I tell my juniors or I teach my people, that each doctor should write the full prescription. It should not be half prescription. That means I write my prescription, the cardiologist writes his, the gastroenterologist writes his, and the nephrologist writes his. So then we are not on the same page.
Yeah.
So what I do is I write one prescription for all of them, everyone. So I know what is the drugs, what are the medicines he's taking, is there a drug-drug interaction, and can I help this patient by reducing the medicines or by reducing the drug-drug interaction. Having said this, I think, as patients, I would sort of advise you to be open to your doctors. After all, doctors are also human.
Sure.
And the best way to improve the system is to find a fault with the system. Nothing wrong in that. Nothing wrong in finding fault. So if you feel that the system is not up to the mark, then you should make a specific comment. Like, recently one of my friends made a comment that he went to a specialist and the specialist saw him 3 hours later. Which is not fair to the patient. I would also be upset if I... So I think, it's very important for you to maintain a dialogue.
Sure.
Between the doctor and the patient. Yes, sometimes it's a hard dialogue. It's not an easy dialogue because the dialogues are that, the charges are more or the costs are more and so on. But please remember that medicine itself, because of its complexity, because it's, it's a part of the system, it's not, medicine is not separate from the society. This point of putting doctors on the pedestal is not fair to the doctor.
Yeah.
It's not fair to the doctor.
Too much of a pressure.
Yes, too much pressure. You put him on the pedestal is not proper to the doctor. Don't put him on the pedestal. Treat him like a normal human being. Treat him like a person who's, and also give him feedback. See, like you've given me a feedback and I'm trying to answer that question. Yes, give us a feedback. You feel the charges are more, you feel that the time taken was more, you feel the investigations were more, please give us a feedback. Because we are not going to improve without feedback.
True.
And the same is true for patients as well. So I would also give feedback to patients, saying that I want you to come on time. I want you to carry. Sometimes, patients come to me and they don't have their drug list. They don't know what medicines they are taking. They don't know whether it's 100 milligram or 500 milligram tablet. They don't know what the previous doctor has prescribed to them.
Yeah.
So Hindi में जैसे बोलते हैं कि हाथ हिलाते हुए आ गया. So I think that also, they don't bring their MRIs.
Yeah.
They don't come with their tests. They say, I forgot it in Vashi, my MRI. And he's come to a neurologist. So I think, so these are feedbacks I would like to give you all also. So you give us feedback. We will try to improve. I promise you give us feedback. We will definitely try to improve. We'll give you feedback also. And I think it's both ways. So
do you think the hospitals do have this mechanism to take the feedback and actually evaluate as a team together, at the back end? So does that happen?
Yes, it does, because it does happen. And I can say for the Gleneagles Hospital where I am right now, yes, we have had feedbacks and we have tried to change, things. We have tried to, and we have even had feedbacks about the cost. We have had feedbacks about care. We have had feedbacks about, the hygiene, everything. And we've had very good feedbacks as well, that this is good and this is, But when we get negative feedbacks, we definitely try to, work on it, try to improve where we can, and set up systems where we can. So I think it's something that we need to do continuously.
Sure.
This is where I think the doctor-patient relationship comes in, and it's a dual relationship. It's both ways. So I think it's very important for you to give us feedback and we to give you.
Communication is the key, and I think an open dialogue where you accept each other's feedback. I think that's very important.
Yes.
Thank you so much, Akshay, for sharing in that question, and I hope we've been able to address your query well. All right, Doc. So with that, I believe that you did mention that doctors, it's serious business. Medicine field is very serious. But doctors are also allowed to have some fun, isn't it? So with that, we move to our next segment, which is called the 60-second spin. It's a fun segment where I'm going to throw questions at you, and you have to be quick. It's all about the speed. You need to answer as many questions as possible within 60 seconds. So are you ready to begin?
Yes, I am.
Awesome. If not a doctor, you would be?
A pilot.
A common misconception about stroke that you often encounter in your practice?
That it never recovers.
Funniest question that patients ask you?
Doctor, iska guarantee hai kya?
And what's your reply?
Actually, I laugh and I tell them only Bhagwan guarantee de sakta hai, aur koi nahi.
And warranty hai, guarantee nahi. A simple yet mind-blowing fact about the brain that you wish more people knew?
Yes, that it constantly is changing. And so you need to change your ideas as well. So every day in the morning when I get up, I'm a new person.
Most rewarding part of your job?
The smile that I get when I come out of the ICU.
Sweet. Your inspiration?
My father and mother.
Your favorite movie?
Diwar.
A typical day in your life?
Yes, tea and then the whole day with patients. Of course, my wife's smile in the evening.
Oh, sweet. How do you manage stress and avoid burnout in such a demanding field?
I play music and I sing. I'm not a great singer, but I enjoy it. And I think everyone in his life is a singer.
Nice. And that's the end of 60 seconds, and you did exceedingly well. 10 on 10, I must say.
Thank
so
you.
Great. Kudos to you.
Thank you, Bhavna.
So there is no goodie for it, but you did well. All right, so with this, we move to our concluding note and the last segment, which is called the Expert Edge, wherein I would like you to share one quick thought on why leadership fails and one mantra for being an effective leader.
I think the main reason why leadership fails is not realizing that people are different. And this is how, it happened to me as well. When I started practice, I felt that everyone should be same, everyone should have similar thoughts, but people are very, very different. And if you recognize that people are different and they're telling you something about the world, they're teaching you. So every one of my patients has been a teacher. I didn't realize it, and that's where the difficulty comes in. So I think the best way to be a leader is to recognize that you're surrounded by teachers,
Nice.
and good people.
Thank you so much. And thank you so much, Doc, for your valuable time today, sharing your experiences and insights with us. This has been truly a wonderful conversation. Thank you to the audiences for staying with us. I hope you found this conversation inspiring and enjoyable. Remember, true leadership begins with self-care. A healthy leader inspires, motivates, and uplifts others. If you resonated with this episode, hit the like button, share it with your network, and drop a comment with the best takeaway from this conversation. If not, just say a hi. We would love to hear from you. Also, stay tuned to Why Leadership Fails for more such awesome and inspiring stories. Until then, all you leaders out there, keep slaying, keep inspiring, and continue leading the way. This is me, Bhavna Lalchandani, signing off.